Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name's Dr. Clayton Johnson. I'm the host of the podcast, and we are going to kick off part 2 of our episode on the Morrison Swine Health Monitoring Program, or MSHMP, as you often hear it called, with Dr. Cesar Corzo. Dr. Corzo is an associate professor at the University of Minnesota, and he has really shepherded this project since Bob's unfortunate passing several years ago. Dr. Corzo gave us a part 1 of this podcast. So last week, we heard him explain what is MSHMP, how is the data collected, what are we measuring, and he also gave us some perspective on this PRRS incidence. Is it a bad year or not? And the reality is we have a lower cumulative incidence this year than we have in previous years. Now, in this part of the podcast, we're going to dive into some more details, some more analysis of that data set. If you haven't listened to part 1, I would encourage you, hit pause on this one, go back to our previous episode. And I think you'll appreciate that background and context before you dive into part 2. If you've already listened to part 1, with no further ado, let's go ahead and turn it over to Dr. Cesar Corzo with the University of Minnesota to start diving into a little bit more detail as we analyze what we can learn from the MSHMP program. Cesar, perhaps in terms of the prevalence of PRRS and is it a good year or bad year, kind of what you're telling us is that it's like being a fan of a particular sports team, right? If we ask, is this year a good year for basketball? Well, if you're a fan of the Timberwolves, you're probably saying, yeah, it's a great year for basketball, right? If you're a fan of another team that's having a down year, right? Or if your system's having a challenging year for PRRS, it's probably hard to look at that global perspective and appreciate that, there is some success out there other places. But I guess, the next question we have to ask is why? Why do we see that lower incidence overall as an industry? And Cesar, do you have any thoughts on that?
That's a good one. And I don't think I have the perfect answer. I think it's a combination of factors, right? And when we look at this, some of the folks that will be listening to this may remember some of their epidemiology lectures in which we talk about the epidemiological triad, right? The host, the environment, and the pathogen, right? So we've been looking at that carefully, and we've been asking ourselves, what has been different in the last 10 months, right? 12 months. One of the things is that the winter was pretty mild. The fall was pretty mild, was kind of dry. Precipitation was not what some folks expected, right? So we just wonder, how did that have an impact when it comes to transmission? So that's one, weather. 2, I want to give credit to yourself, Clayton included, and all the other veterinarians and all the producers, because I feel like it would be a mistake not to say that all the biosecurity efforts the systems are doing today aren't paying off, right? So I think all this ASF scare and all this PRRS L1C144 scare has not done anything. I think it has. So I think people little by little have been improving their level of biosecurity. So I think that helps. And within biosecurity, we have to talk about truck washes, filtration, disinfectants, feed mitigants. I think this is the whole package. I think that has helped. That's one. That's another one. Now the third one would be, which is unfortunate, and I think we have reached this plateau when it comes to 30% of the herds winning positive pigs. It hasn't been the highest. We've been there before. In the past, we would see our peaks as 30%. What I think this is doing is that there might be introductions, like viral introductions, into these unstable herds that maybe go on or are going unnoticed, right? Maybe. I mean, there might be, our project is not perfect. We may be having some underreporting. So that may be also having a toll on this, which leads to fewer reports. Therefore, the incidence is low. So again, I don't know how much weight I would put on that, but I'm sure that that's occurring. And the other one I feel, Clayton, is that even though We have nasty viruses out there because we have lots of nasty viruses out there. And I already mentioned biosecurity. I also would like to say that besides biosecurity, we have a compliance factor. Because one thing is all this biosecurity, but I also like to separate them with compliance. Are we better at a compliance in the compliance scale? I want to say yes. I want to be positive. I want to be encouraging others because hey, we may have the best filters, the best mitigants, the best truck washes, but we have a lot of people out there doing the work for us, making sure that these tools are used appropriately. So I want to say that compliance, I want to give them credit as well. Again, I think it's going to be a combination of those four, Clayton, that might have helped us keep this virus at bay. Now, there's other discussions as far as yes, the industry shrinked a bit last year. There were quite a few depopulations here and there. Did we got rid of some sow herds that were, I don't know, they may have 2-3 viruses in them, and maybe we were just putting fewer viremic pigs into the complicated regions, maybe. But hey, again, that's I don't know if that's going to play a role in there, but I think that may happen every year, right? So it might be a combination of factors.
Imagine being able to monitor your animals and farm climate remotely. The Healthy Climate Monitor combines camera and sensor data, and they will give you real-time insight into behavior, temperature, CO2, relative humidity, ammonia, and air pressure, light intensity, and particulate matter. We give you insight, and you get control. Find us at healthyclimatemonitor.com.
Yeah, that last point, Cesar, I think is very good. The reality is this is a low margin business, and there are always going to be some producers who have poor performance, biological and economic, who are going to sort themselves out of the industry. And the economic stress the industry's had the last couple of years has probably forced a little more turnover than normal. And I'm guessing it's not a lot of PRRS naive farms that never break that are the ones that went out of business, unfortunately. And Cesar, that really brings me to, I think, one of the most important questions. This is one veterinarian to another here. If a producer comes to you and says, Cesar, I don't believe in the biosecurity. I don't think I can prevent PRRS from coming into my herd. And not a producer who says it's not cost effective, but just one who says I can't do it, right? Ignore the economics for now. But what do you think, Cesar? Like, if it's the Cesar and Clayton pig farm and we have unlimited resources, can we put that pig farm in the middle of southern Minnesota or Iowa or North Carolina, some of our really pig dense areas, and still keep PRRS out? Is that possible with our knowledge and technology today?
That's a good one, Clayton. And there was this one project that one of my team members, Dr. Mariana Kikuchi, she published this not long ago. And this was based out of, I don't know if it was you, Clayton, or someone from the MSHMP participating group who asked us that question. And it's, if I take my herd to a naive status, to a category 4, how long am I going to be able to keep that herd negative, right? And Mariana showed some very compelling information in that, hey, there might be herds that may be PRRS naive for 9-10 years, or herds that have been naive for the whole length of the project or even longer, right? So going back to your question, we do have herds in high dense regions that, yes, a lot of people would say that herd is not going to survive weeks without getting PRRS. Well, the data tells us that those herds that are in high dense regions that are filtered, that I'm sure that they are really good at biosecurity, not only from a compliance perspective, but every little single detail is being people are paying attention to. They have gone through different waves of PRRS outbreaks. They have remained PRRS free. Yes, are they investing in biosecurity a lot? Yes, but I feel like it's paying off. So if it's the Clayton and Cesar farm in the middle of South Minnesota, I would bet that if we have the right team, the right tools, if we have the right mindset, we're going to be able to keep it PRRS free. Of course, there's the odds of getting an introduction, but I'm sure that if we get one, maybe the second introduction may happen 3-4 years, 5 years later. But it's not that we're going to get hit every year. During the 144L1C outbreak, because we had 2 waves, there were some farms in the middle of this fire that survived, Clayton. And yes, they were filtered. Yes, they had a lot of investment, but they were able to capitalize on those, I want to call them PERS negative days, when everybody else around them were suffering with PERS positive days. So I think they were able to get back what they had invested over time. And I'm sure that nowadays they will, if we go back in time or in the future, they will do the same thing, fight for it and be good and as compliant as possible to keep it PERS naive.
We tend to be attracted to the horror stories more than the good stories. But I think, Cesar, you do a great job of highlighting both and really letting the data tell the story. To me, that's the huge value of MSHMP is, it doesn't need to be Cesar and Clayton having a hallway conversation at the layman meeting about, is it a good PERS year or a bad PERS year, right? We have data. We should value the horror stories, right? The farms that break with the lineage 1C, we need to study them, right? What can we learn from that? How can we get better? But just as much, we need to study the ones that don't have that challenge and learn from them, right? Apply the lessons learned, because I think that's one of the biggest challenges we have in our industry, Cesar, is just getting the industry to believe that we do have the technology, we do have the ability to solve this problem, but it takes buy-in. Right. It takes and it takes certainly some level of investment. Right. We've mentioned filtration a couple of times. You probably can't have the rendering truck come to your farm every day if you want to stay healthy. So it does take some investment, but I don't know any producers who've made that investment who've regretted it. You know what I'm saying? Like, raising pigs when they're healthy is fun, and it's a lot of fun as a vet to be involved in that at some point.
Agree. One of the examples that I tell the students here at the university is when we had the COVID epidemic, right? I brought the same concept of biosecurity in the pig farm to personal biosecurity. And I always told everybody, if you are compliant, if you are good at compliance, you will not get COVID. But a lot of us got COVID and we thought we were good at compliance, right? So at some point we gave the virus an opportunity, and hey, that's what viruses do. They're looking for the next host, and we gave them the opportunity. So same thing with pig farms, right? If we give an inch of an opportunity, they're going to capitalize and they're going to score, right? So same thing with COVID. and we know that COVID was a massive outbreak. And you ask people, they were using their gel, right? They were using their mask, and still they got infected. And they ask us, how did I get infected? Well, you need to go back and check at your compliance, because that's something that us as humans, in some cases, we're not good at.
Yeah. It's like, they would say, oh, the lockdowns didn't work. Well, it depends on your definition of a lockdown. And did we execute it, right? Like, it's.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
Cesar, tremendous information. I can't thank you enough for coming on and joining us. I know our audience is really going to appreciate this. And feel free to give another plug for MSHMP. If there's somebody out there listening and they want to get this information, right? They want to stay up to date on these trends. How do they get that information? Where can they go find that?
Yes, so I think the easiest. So we have a website, mshmp.umn.edu, or you can just go to Google and just type MSHMP. It should take you to the website. But if you're interested in joining, hey, this again, joining the program is free. It's a voluntary program. You, Clayton, you're a big supporter of this project. We get to, at the end of the day, we work for you, but we also work for the industry. But you all work together, because whenever you have an outbreak, you're going to call us, and I'm going to call Clayton, and Clayton is going to call his colleague. The idea of this is to work together, and I think that's what Bob Dream was, right? He wanted people to work together. So, hey, if you're interested, please reach out to us and join us, because at the end of the day, this project is from the producers for the producers, right? We're just helping you canalize and massage and aggregate this data so that we can move forward faster.
Thank you, Cesar. Thank you for continuing in Bob's legacy with this project. And thank you for coming on the podcast. And to our audience, thank you very much for joining us. It's been an absolute pleasure for me to spend this time with Cesar, and I really hope you got as much out of it as I did. For Dr. Clayton Johnson and Dr. Cesar Corzo, we want to thank you for joining us. We wish you a great rest of your day. And please tune in to our next episodes of the Swine Health Blackbelt Podcast. Thank you very much.
Hey, everybody. We're always searching for the latest and greatest research to share each week. If you have a swine health-related research trial and would like to come on the show and talk about it, share it with us, please feel free to email the research to hello@wisenetics.com. That's HELLO@WISENETIX.com.